Medical Education Society. So congratulations to her from the entire team, and Supriya, Chitra, and all the faculty members who've come here. A very, very warm welcome to MUHS, because I mean you're coming here and being part of bringing about a change. It's easy to see saying everything ठीक नहीं है, वो ठीक नहीं है, but Gandhiji said let's be the change we want to see. And MUHS believes in that. And we think of thinking out of the box. Abhi ye kamra hi dekho na, it was a square box. There was no room here. It was just an open space. And we decided that one day we walked and we said, why can't we have a nice round where there are no corners, no jutting. It's open spaces and we can all sit around in a circle and do. And this room was created. So this is thinking out of the box ideas. Or that little genie we bought. Normally you put a candle, but see everything here in MUHS we do with a lot of thought. So the same way, I don't know if they've already mentioned to you, but the last 2 years have been amazing. First year in our vision document was about infrastructure. We did a lot of that. But second was about academics. And in that, today in fact we are celebrating in the MUHS because some amazing things have happened as innovative. The blueprinting, a large number of you may have even been part of the thing because it's all a teamwork. So we finished blueprinting of MBBS, we finished of BDS, we finished competency base for homeopathy, competency base for physiotherapy. So it's going and not just being followers of what NMC say, but MUHS has become a leader. So now we tell NMC this is how it should be. So that's how we have slowly evolved to the next stage. Besides that, I think something brilliant that has happened is we are the only health university with NEP, all rest of this is the way educators. We'll have to sometime or the other start understanding the philosophy of NEP. So we've converted near 200 courses into competency-based programs, credit-based, with assessment, with an academic bank of credits being this thing from this July. So this is another huge thing which Dr. Payal led and helped by Supriya, Dean and MUHS. So that's another very, very big achievement. And the third, another excellent this thing has been a degree plus program. We all complain and school, teachers are piled with too much of administrative work. So the fun and passion of teaching goes away. But I always tell, even at the last CISP, I said, that will keep happening. Even I'm piled with tipniyas. I think about 50 to 100 of them come every day. So I do that as this is a must do, finish and keep it aside and now get enthused because you need something to spark yourself through the day. So our rest is our creativity which we go to, and something even more fun which is we are doing for the first time is a course in integrated approach to wellness. A primary health care for MOs, because today's MBBS, the society is complaining, there's no doctors left. There are only ISTs there. So a patient has to decide which IST is going to treat. So they are, even when they ask, they say, but gastroenterologist kade jao, cardiologist kade jao, ite dukhta hai. So this is the state we've come to. So that's why I thought it's so important to have this thing. So we are giving a skill-based program. We are making family medicine. We're also giving a degree plus, which are going to be, we've acquired an LMS, so that's why, so that we can reach students. And why am I sharing all this? Who's going to be the backbone of all this? It's you people. So anyone who comes up with an innovative idea, okay, I'm good, because we don't know sitting here and each one is a gem. We all got together the same people, suddenly we are identifying who's got a capability. So I'm sure there would be a lot of you who excel in something the way you teach. So if you would like to sort of join in this e-learning where you will have followers, not just YouTube, but MUHS LMS platform, you all can say in your speciality that this is a skill which students need to learn. And we have a format, we have this, you can contribute, there's peer review and lectures which are there, assessment, and at the end of it, it's even in a hybrid. There are some modules in which the student is told, now you listen to this, but go and practice this on a patient and use your mentor or your teacher to evaluate you for that. So it's a hybrid mode also we've kept. I think that is what is important today. Baki to people, and the truth is, we are just conducting a study. Lots of very good students don't need teachers. So I don't know whether we should. I've been questioning, should we teach teaching technology like TTI and CISP and things? Should we teach that, or should we start learning? How do students want to learn? We say education is student centric, but students are least interested in PowerPoints. Everything is today available in their own time, own this. They're looking at YouTube, they're looking at it in the languages they like. And then their peer group learning is happening. And then, so there are just colleges with 40% faculty and the students are passing. So I think it is time for us teachers to say, okay, we will have to conduct exams, and slowly the drudgery is going to go out of. I'll tell you how. One, we are going to go on to the online, so a lot of paper, this thing will happen very fast and very automatically, of compilation software will be implemented. Second, we are trying to reduce the burden of LICs and paperwork. More and more with time, we will keep on having more automated, which captures data, so we don't need to really look into. And the third is also, the paperwork which is involved, everything getting online at your time, your space, if you can do it, you will be left with time for creativity. And that is what is important when you're implementing this new curriculum, CDME. CDME is extremely sort of heavy on the teachers, because you have to do feedback, you have to give evaluation, you have to do and then there has been a horizontal and vertical integration. And most of the times, even in colleges, we don't talk to each other. Within the department, you hardly talk to each other. Inter-department to hota hi nahi hai. There is nothing like integrated research. And then a VC comes along and says, not only integrate yourself, integrate with Ayurveda, integrate with homeopathy. But the fun is in that. The fun is in that. So we'll have to find solutions. And I'm sure you're going to enjoy this course. But please take time to enjoy the campus. Those who are staying here, I recommend strongly that at night you must go and see the Five Senses Garden when it's lit up at night. Because we take pride in little things. Now this Friday we will be all, the campus is not like this just because someone came and did a bond like that. It is changing the mindset. And when the first thing on education is, we say it changes your behavior. It changes, education is to change your thought process. So here we're doing experiential education, which I'd like you all to go and take back. So that is there something you can implement, whether it's a plastic-free campus, whether it's a green campus. The students look up to people who have ideas beyond textbook teaching. So let us not let them down. Let us live up to that and bring back the glory of teaching and the passion. With that, I wish you all the best. Please have a good time, and don't forget to give us ideas, because only good work will happen when there's collective competence. Individual brilliance will not bring about a change. So there's such a huge mass of collective good faculty who's come here, and just imagine if 30 people just share one ki aise karna, and from that we pick up those. Look at the change that can come in. So use that to teach each other more than what the faculty has to say to you. Thank you so much. All the best. Jai Hind.